Hello everybody, it's Friday. Thanks again for watching. Yesterday we opened the video with the picture of Allison's cat Adrena watching the video, and it reminding me that at least her cat was watching. And thanks to everybody who sent me the emails last night to said, no, other people are watching it as well. I absolutely appreciate that, and I want you to know that we're doing these videos to keep you as informed as we possibly can, as soon as we possibly can. I did get a picture last night from Alyssa Prince from the Command Center of Employee Health. Wonderful picture. You can see here that the room that they're in has been repurposed. Its original purpose was the Norton Healthcare Board of Trustees boardroom. So as you can see, in times of great need, we all are willing to repurpose everything we can for the good of the community and the good of the organization. And these are wonderful people who you've heard me say, if you have any questions, call Employee Health, 446-2683. Well, when you're calling, this is the room that it's going to. This and two other rooms on the other side of it. So we appreciate the great work that's happening there. They're getting 300 to 400 calls per day. Wonderful things are happening there. We're able to communicate with people who need that information on a regular basis. So thank you very much to everyone in that command center. And I could see in that picture on that big screen at the end, it looks like you're watching me. So I do appreciate that. And it's good to know that somebody other than cats are watching my videos. So thank you once again. Thanks for the great work that's being done there. Let's get right off with the numbers. 253 patients have tested positive at Norton Healthcare. That's up 7 from yesterday, but we did receive 130 tests back yesterday. So again, we begin to get test results back from the other labs and in those batches that we talked about. We have 42 of those patients who are inpatient with us currently. We have 13 at Norton Hospital. We have 13 at Norton Audubon Hospital. We have 9 at Norton Brownsboro Hospital and 7 at Norton Women's and Children's Hospital. So overall, we've tested 2,295 people, and we're still waiting for results on 412. So from the employee perspective, we've already tested 476 employees. We've had 65 that have tested positive. That's 1 up from yesterday. I want to continue to explain that we work with everybody on a one-to-one basis throughout that whole process. Of that 65, we only have 1 that is in our inpatient care. We ask that you continue to have that person in your thoughts and prayers as you do all of our patients as we go forward. I mentioned the Employee Health Call Center. Told you that we were receiving about 300 to 400 calls. Yesterday we received just over 350 calls. We currently have 434 employees on furlough. As I mentioned yesterday, no furlough is exactly like the other. They're variable times and variable circumstances, and that's why it has to be an individual conversation that takes place. A great number that we always like to see, how many have returned from being on furlough and are back being able to be healthy and in the workforce. And that total is up to 148 today, so that's very good news. That's up 34 from yesterday. So as you can see, the process works. Work together with Employee Health, work together with your leader, stay in touch with each other, and we're able to get through this in the right sort of way. Yesterday we talked a whole lot about PPE, as we've done every day on this video. You heard me talk about using that Employee Health, that line 446-2683 with an option 3 if you had questions about PPE. Thank you for those who have used it. We've had good volume through there. We've had good questions. We've had very reasonable questions. And it always helps to understand that that protocol is so important. When we're on universal mask protocol, it's really important that you understand the proper way to use the mask, proper way to take off the mask, proper way to dispose of the mask, when to use the mask, what's the right mask for the task. So we want to make sure that we continue to have opportunities for you to get answers to those questions. I always say, if you've got a question, find your leader. If you can't find your leader, pick up that house phone, hit 0, talk to the house supervisor. If that doesn't work, that's why we have that 446-2683 line, option 3. I also get some questions from time to time that say, hey, since we started that universal mask protocol, why is it that patients and visitors don't have masks on? So today with us we have Pam Isaacs, who is leading us through this infection control process, and it helps us in so many ways begin to understand all the intricacies and nuances of what mask and and how we use it properly. So I've asked her to join us today and walk through some of those things. So Pam?
Thank you, Russ. Regarding those visitors and our face masks, we are providing surgical face masks to those patients when they come in with respiratory conditions. Our other patients and visitors, though, we want to provide our cloth masks that have been made and donated by our community. This will help us to conserve our hospital-grade PPE for our medical care providers and still provide that protection to our visitors and our patients while they're in public to remind them not to touch their face unless their hands have been cleaned. Our surgical face masks are worn by our clinical staff. Everyone that comes into the organization will not only have their temperature checked and screened, but they also receive a surgical face mask and will be asked to wear that for the duration of their time here at work. We also will use our surgical face masks for all patients in droplet isolation. That would include our COVID-19 isolation patients. And our surgical face masks are worn by our operating staff or our procedural staff anytime they're in any kind of sterile procedure room, operating room, or procedure room. Our N95 respirators and our PAPR respirator are used for those patients that would be in airborne isolation, as well as by our staff that are performing any kind of aerosol generating procedure, such as a respiratory treatment or intubation. Norton Healthcare has implemented a number of protocols to protect our patients, our staff, and conserve our PPE. Among those are our essential staffing practices, where we ask staff to block patient care with our isolation and non-isolation patients so that we can utilize our PPE appropriately. We can use our extended use surgical mask protocols and our extended use and reuse protocols for our N95 respirators. And as Russ always likes to remind us, right mask, right task. If you have any questions or concerns around your PPE, don't forget the employee health line, 446-2683 or 446-COVID, option 3 for PPE.
Thanks, Pam. It's great to have somebody who has such knowledge as you do, because this is such an important aspect of everything that we're going to be doing over the next few weeks. So we appreciate that. I know we've said it before, we'll say it again. 446-2683, option 3. We can answer those questions that your leader or that house supervisor may not have been able to or wasn't available to. So thanks again for all of that. Now, today is payday. As I mentioned yesterday, it's our first payday since we've gone to making sure that you get compensated for those budgeted days and for the furloughs. So far, we think it's gone pretty well. If there's issues that you think we need to get resolved or something that doesn't look quite right, get to your leader immediately. They can work with Human Resources to get that resolved. But we don't want that to be an issue on your brain. We don't want that to be something you're worried about, because we want you focused on staying well. We want you focused on being ready to take care of patients when that time comes, if you're not already taking care of patients. So make sure you go to Insight. There's a frequently asked questions section there about this particular payday. Maybe you can get your question answered through that. If not, we absolutely assure you somebody from Human Resources will work to expedite any questions you have getting answered very quickly. So again, thank you very much for everything that you're doing every day. I told you yesterday that every time I finish an email, every time I have a conversation, I try to use the same phrase over and over again, and I'm going to use it today, and I'm going to thank the wonderful people at Norton Women's and Children's Hospital who sent me this picture. It says exactly what I'm going to say to you every day going forward, and hope you say it to everybody else too. Make sure you stay safe and keep the faith. We'll talk tomorrow.